friends, and welcome back to my Unhealthy Podcast. I am your host, Uncle Marv, and this is the show where we talk about the things that they're supposed to be healthy, but sometimes they're unhealthy, and then we look at the healthy things in an unhealthy way and vice versa. And it's just that show where we try to figure out how to fix things in our lives one step at a time, one conversation at a time. And that is what we are going to do again today. We're diving into a topic that a lot of people are quietly struggling with, long COVID and post-viral illness. My guest today is Dr. Zeest. She is a physician who also lives with long COVID, and she's a doctor of long COVID MD, a podcast and resource that helps people recover like a doctor without getting lost in the medical jargon or internet chaos. Dr. Zeest, welcome to the show.
It's so nice to be here. Thanks for having me. I like how you described long COVID MD.
Okay, well, I did something right, so off to a good start. So I guess before we get into long COVID, let's talk about life before. What actually drew you into medicine in the first place?
Oh, gosh. I think I always either knew I was going to be a doctor or always was told I was going to be a doctor by my family. I was really happy to pursue medicine because it struck me as a field that was really challenging, but you got to impact people's lives, help others, and serve. And I had that value very early on. And just perseverance and a lot of luck.
So I know we're going to talk a lot about what happened after the year of our COVID, but what type of work were you doing before the year of our COVID?
Sure. I'm a physician. My specialty is a mouthful. It's adult cardiothoracic anesthesiology. I'm an anesthesiologist who specializes in the care of people getting heart and lung surgery. So open heart and lung surgery and robotic cases as well. A lot of that skill set, because we have to, take care of very, very ill people in critical situations and use a lot of technology that not everyone is trained on. A lot of those skills overlap in trauma surgery as well. So my medical practice was a mix of really high intensity heart, lung, and trauma work. And then outpatient surgical procedures, including, little kids getting their tonsils out, or someone getting shoulder surgery. So it was a really nice place to be in my career.
So what you specialize in, because that's a huge overlap. I mean, the cardiovascular alone sometimes I think is just its own discipline, but you kind of overlapped in some of those areas. Those are the types of things that we understand to be the hardest hitting in the medical profession, right? Most people, they see the ER and think it's, fast-paced emergencies and all of that, but having to be in, cardiovascular, heart surgery, brain surgery, that's got to be intense.
Yeah, and our care starts before the surgery and well after. So we spend a lot of time in the ICU. It's almost an extension of the operating room. It can be the pre-anesthesia unit and the post-anesthesia unit. So, I ask a lot of people if they've watched that show, The Pit. And most people say, yeah, they've watched it. And I have not, because it's pretty spot on to the experience of, the really high intensity, sometimes really, really challenging work that I've already been through. I don't need to watch it again on a screen.
I was going to say, I have heard that is the most realistic of all the shows, even if you go back to, ER.
Yeah.
And, well, I don't count the, what is that show with Dr. Grey's
Anatomy?
Yeah, I don't count that one.
Yeah. Me neither. That's a soap opera.
Okay. Now, from what you described, I would not imagine that an anesthesiologist actually dealt much with patients before and after. How much did you actually do with them? Because I just assume you guys would show up for the surgery. You put the thing on the mouth and nose, and then monitor.
Have them count backwards from 10, and then that's it. Turn on the anesthesia, turn off the anesthesia. A lot of people have that understanding. Anesthesia is one of those fields in medicine that's described as shadow work. You don't really know as a patient what your doctor is doing until something goes wrong. And so if we're doing our job right, you don't really think about us very much. You don't remember us very much. But particularly in these big surgical cases, it's really important to have a continuity of care. And that's not something that anesthesiologists are excluded from. We want to make sure our patients are optimized for surgery, are safe for surgery, because there's a lot more to the body than the one part that, like say your gallbladder. There's a lot more to you than your gallbladder. And you might think the only issue I have is I need to get this gallbladder out. But anesthesia requires the understanding of a lot of organ systems, how the body works, how different things interplay, how patients react to drugs, both kind of standard, typical studied doses, and how we can personalize care to each and every patient. And I think that training and experience has helped me a lot as I've navigated long COVID and as I try to help other people understand this disease too.
All right. My mind just went a couple of different places with questions I could ask about your anesthesiology, but let's get into the reason we're here. I described you as somebody that is living with long COVID, so I guess the best place to start is, where did that journey start for you?
Sure. So before I tell you how I developed long COVID, I'll explain a little bit, if it's okay, what long COVID is or what we know about it.
Sure.
So long COVID is a term that was coined by patients, and it's what a lot of people recognize as the name for this condition that occurs after your initial COVID infection resolves, like your flu-like symptoms or respiratory issues, the stuff that happened right when you get sick, gets a little bit better, and then you start developing some other symptoms. Medically, it has a couple of names or acronyms: post-acute sequelae of COVID. Another one's very closely related with the same letters, basically post-COVID-19 syndrome, post-acute COVID-19 syndrome. So acute means, immediate onset. So you get a COVID infection, you'll typically have anywhere from an asymptomatic infection to like really severe symptoms that require you to be hospitalized. That initial infection is what's called the acute phase. A lot of us have gotten COVID, those of us with long COVID, started to feel better from those initial symptoms. And then these, group of symptoms that were really confusing started to pop up. So what happens with long COVID is that it is a post-viral chronic illness. You get a viral infection, and then you're left with chronic issues that last quite a long time. Most people will complain of fatigue that doesn't really make sense. And the fatigue is not just, I'm tired, I need to catch up on my sleep. It can be debilitating. At my worst, I kept having the image of a marathon runner in a race at the finish line collapsing. And that would be after trying to walk down my hallway. A lot of people have their circulation affected, so their blood pressure might change. They have a change in their heart rate, maybe have really palpitations and a very fast heart rate. We hear a lot about brain fog, but what that really is better described as a cognitive injury or traumatic brain injury. I have lost my smarts. I've regained them quite a bit. But at my worst, I couldn't understand the alphabet anymore. I couldn't tolerate light or sound. And it was really like having a concussion where nothing really made sense and all of my five senses were out of whack. And that really severe period for me lasted a year. And for other people, they may present with a different set of symptoms or a different combination of symptoms. But typically, long COVID is a condition that occurs after the acute COVID infection resolves and are marked by fatigue and multiple organ systems being bothered. A lot of people even have problems with their digestion that can be really, really troublesome.
So this is something, let me just kind of get my head around some things here. So I've heard that long COVID can be kind of something where you've had it at least a month or more, but it really doesn't get diagnosed until around the 3-month mark. Does that sound right?
Yeah, so that 3-month mark is really on point. Long COVID is considered diagnosable when those symptoms last for at least 3 months or 90 days.
Okay.
If they haven't resolved by that 90-day period, you're considered someone who has long COVID or PASC or PAX, how it's called in medicine.
Okay. And then you talked about fatigue, and I understand it to be, not just your I'm tired, but, this extreme fatigue. You talked about, feeling like you had just finished a marathon and were ready to collapse. And is this like a continual thing? Like you always feel that way, or does it go up and down on a regular basis or irregular basis?
So my really severe period was a year, maybe 2 years. I like to look back optimistically, but when I think about it, it's like I was in pretty rough shape for a while. But once people sort of, I guess I'll say some people's symptoms go away. They resolve and people recover completely. A lot of us are left with many years of symptoms. And those symptoms are sometimes, for some people, severe all the time. And for a lot of others, it's what's called waxing and waning, or it gets worse and then gets better for a period of time. One of the really stickiest symptoms is called post-exertional malaise, which basically means after you exert yourself, you feel terrible, but it's not the same as going to the gym and what is expected. I lifted a few more reps than I did last time, and like my biceps are sore. I did more squats this time than last time. My quads and my hamstrings and my glutes hurt. This is a sort of flu-like symptoms that can come on in a delayed fashion and out of proportion to the exertion.
Okay. So let's now kind of go back, if you'll let me, to when did you first realize that this was happening to you? Because, working in the medical field, you were probably around a lot of people in 2019, 2020, going through all of this. And, a lot of us didn't understand the stuff back then. And a lot of people probably had COVID and didn't realize it. When did you first have a COVID incident?
Yeah, I'm one of those people that probably had COVID and didn't realize it. I work and live in an area that was really hard hit by COVID-19. If you remember those maps that were drawn that used color coding, we were red from the moment those maps were drawn to the time that they stopped being published or made. And we had outbreaks among the hospital staff. We did not have tests when I fell ill in the spring of 2020. I have a history of allergies and I live in an agricultural area. So I thought I was just having another sinus infection or, an asthma exacerbation. Something got triggered. But I started to notice that I wasn't bouncing back the same way as I typically did. I suddenly needed an inhaler My lungs were really struggling, and I kept getting more and more tired instead of recovering. And so by the end of 2020, or by the summer, but certainly by the end of 2020, I knew something was wrong, but I didn't want to step away from work because it was a really, really difficult time, if you remember, and we needed all hands on deck. And I already live in an area that there's not enough doctors, there's not enough hospital staff. So every one of us was carrying a pretty big load. So I kept working. I kept pushing through. I tried to ignore my symptoms and certainly treat them with everything under the sun, kind of in between surgical cases, calling my doctors and asking for prescriptions or talking through what might be going on. At the beginning of 2021, I was like, okay, something's going on here and I have to stop working. I have to step away for a little bit. So in April, I'll stop. I won't take any more work. And I didn't get there. So in the beginning of March,
you didn't get to April?
Didn't make it to April. At the beginning of March in 2021, I left the hospital after a pretty typical, what was then typical hospital shift. And I couldn't make it to my car. I found a patch of grass and a lovely little tree that will always hold a special place in my heart, because I was able to prop myself up against it and kind of called for help. I just had no more energy to move a muscle. By that time, it had already been months of me having to give myself pep talks in the hospital parking lot to get into the hospital. I had to give myself pep talks to get from the operating room to the recovery room. I really was giving it my all just to move, and I was done. And so I stopped working, and that was the last time I practiced anesthesia. I am still not able to be upright and functional for a whole day because of this.
Can I ask how, not necessarily how you made it through, but what was it like, still pushing through, and your colleagues, did they notice something and ask you about it? Did you hide it? What was happening during your workday?
At that time, it was like we were working on a different planet. It was overwhelming. We had so many patients. We had so much work. There were so many crises that we were each consumed with our work. We were all wearied, and there was enough to worry about than me trying to complain to some of my colleagues or kind of share what I was going through. My instinct is always to hide any potential weaknesses, and I certainly did. I tried my best to tough it out and push through, to continue showing up for my community and to not look like dead weight.
All right. So that was your colleagues. I assume you had family at home?
Yeah, I have a lovely husband, 2 kids who were quite little at the time. I remember, and my parents who are close by in the same town. We were so worried about all of them. We wanted to keep them safe. And, I was the only one really leaving the house every day. I would come home and kind of decontaminate in the garage. I didn't hug my kids for about 6 months, because I was really like high exposure for COVID in my field, and I didn't want to get them sick. And I was gone from home a lot. I was working a lot, and so I kind of kept things to myself. But it was pretty. My husband, noticed, pretty easily that Zeest, you can't keep pushing like this, like something's going on. But we didn't put it together with COVID because I didn't know that something like this existed.
Interesting. So was March of 21 when you went from being doctor to patient, or had you actually started being a patient a little before then?
Yeah, I mean, like I said, I was like calling my doctors. I try not to self-prescribe too much, but I certainly already had, I was like going through different inhalers. We had tried like a round of steroids. I didn't know why I had such bad asthma. I could not breathe. I remember trying to sleep sitting up in a chair in front of an open window to get some air. It was pretty evident that I needed medical care probably well before I admitted it to myself. So I was in touch with my doctors, but March was the time where everything shifted.
All right. So it sounds like that was a dark time when you had to plop down there on that grass. What happened next?
I thought I was burned out. And after it was pretty clear it wasn't that, I just was left pretty confused. My symptoms were severe. I think if I wasn't a doctor, quite frankly, I think I could have had a very different outcome, and I might be bedbound to this day. But what happened essentially was I took a very long rest and started seeing a lot of different doctors, and nobody could really explain why I was having all these different symptoms, why I couldn't think straight, why I was getting so winded, why I was dizzy and feeling like passing out every time I would stand up. And at some point it clicked. I remember after a certain doctor visit, I don't remember which one it was exactly, thinking to myself, okay, I'm not going to get help. Like, I'm just going to keep getting this answer that we don't know what to do. I don't know how to help you. That was the message from my doctors. And I had to sort of figure things out or decide on an approach myself. And so what I landed on was like, okay, I take care of really complex patients who have a lot of different problems going on all at once and are critically ill, and the stakes are really high. What do I do then? Maybe I can do that, apply that same approach to myself and my own health. And that's really what changed the game for me. In anesthesia, and especially in heart surgery, I take care of patients who have issues with their brain, who have issues with their lungs, who have issues with their hearts, who have issues with their circulation, who have issues with their kidneys. And I have to make a decision sometimes. I know all of these things are going on, but I have to do something. And I have to do something first, second, and third. So how do you decide sometimes between the brain and the heart and the kidneys? You kind of do your best, you prioritize and you do your best. And so that's what I ended up doing when I realized that there wasn't going to be a cure easily available, that there wasn't going to be an easy explanation. I was like, okay, let me break it down by organ system, by specialty, because that's how our healthcare field is divided. And if nobody can give me one treatment to treat my asthma, my brain fog, and my dizziness, let me try to get a hold of my asthma. We have lots of great medications to treat shortness of breath. We have lots of ways to work up and treat a really high heart rate and really low blood pressure. The brain fog part was a little bit more challenging. And all of it took time. But what I did was I took sort of a step-by-step, prioritized and personalized approach to my healthcare and tried to make a really complex, interwoven problem a little bit more understandable and piecemeal.
So I had a question I was going to ask, but now I'm going to take it a different direction, because as people listen to this podcast, if they were to see you, they were to think, oh, well, you're fine. You're cured. You're all better now. but that's not really the case. So even though things are better, how much better are they, and where are you at now with your long COVID?
Yeah, I feel remarkably better than my worst, but I still have significant limitations that make it hard for me to take more than a trip out of the house every day, for me to be able to be as active as I was before. I still have a really hard time exercising. Right before we started talking, I was lying in bed, getting ready to, rest up and be ready to speak. And after this, I'm going to go back and rest and take it easy. I'm not collapsing anymore. My brain is much more on than it used to be. Like I said, I couldn't really even comprehend written or, spoken language. So right now, I am so grateful for the life that I'm living, and I really feel like I have recovered quite a bit. The condition is insidious sometimes, and it's limiting, and I always have to keep in mind what my energy limits are while those are growing, and try my best to stay within them. So for me, my energy's been limited, I could say, since I fell ill in 2020. But that energy envelope that we talk about in the fatiguing illness community has gotten bigger and bigger. And so I live, a smaller life than I did before, but it's still quite fulfilling. And I'm really happy that I've been able to pivot my, really intense walking around a physical medical career into one that is more, computer based, and, has I'm communicating with people online now and trying to share and help and serve people in a different way.
Mm. So it sounds like you've described a little bit of a typical day where you're actually resting to prepare for stuff and then resting after stuff. How much of your day is spent in that process? I mean, how normal can a day be for you?
That's such a great question. I was just talking with a friend yesterday that we're really encouraged when you have chronic fatigue to pace your energy, pace yourself through the day. But the problem is this condition is dynamic. It changes from day to day, and it requires so much sort of vigilance and, quite frankly, a bunch of doctor's appointments that I can't it's hard to get a steady day. Every day is a little bit different. You go to treatments, you go to medical appointments, and then you kind of have to learn, instead of setting a really strict schedule, you learn to rely on the techniques that work for you for preparation and for recovery. Kind of like an athlete, but I'm not, playing ball. I'm trying to get through a day.
Right. So with that being said, I don't know how to ask this question in a nice way, but what were you most unprepared for emotionally? Because you said that you no longer can practice. I mean, if an athlete gets struck down in their prime, it's devastating. And that sounds like what happened to you.
Yeah. And I'm not the only one who's had, their life shaken and their identity shaken by this disease, because so many of us tie our value to our careers. And we've put a lot of work and effort and time into those accomplishments. And once they're sort of taken away, we not only lose our time markers for the day, we lose this feeling of satisfaction that we get from being productive. I know a lot of people say we shouldn't tie value to productivity, but honestly, we're human. We want to create, we want to give, we want to feel like we're doing something and accomplishing something. And that doesn't have to be really big. So that's where I have turned. this loss of identity can hit people really, really hard. But for me, Marv, I've taken care of people who are unbearably ill, who are really critically ill, and it's been touch and go. And I've seen people lose their lives. And I've also seen people come back from really harrowing experiences. And I'm not someone who compares my suffering to someone else's suffering and puts a value on it. But instead, I think to myself, if they can do it, then there's hope for me. If they were strong through it, then I can be strong through it. I'm not the only one going through this. And I'm trying to remember that if others can do it, I want to tap into that energy too. The other part is a real reframing where I could say, and I have been sad, that after 20 years or so of practicing really intense anesthesiology, I can't do that anymore and I lost something. And somewhere along the way, I was like, you know what? It was pretty lucky that I got to do that. So that's where I live with my gratitude that I got to do that. I got to do and experience some amazing things. So what does being a doctor mean to me? Why was it so gratifying? Was it because I was in the OR doing procedures and working in really high intensity work? That was part of it. But at the end of the day, I don't remember the procedures as much as I remember people's faces, my patients' stories, and trying to provide comfort in a really, really, really scary time. And I can still be a doctor like that. And so that's where I really try to encourage people to be like, you might have lost something. What brought you satisfaction from that? Is there a way to replicate it? Is there something that you can do to bring structure to your day? Is there a way for you to process what you've lost and then look back on it with gratitude and not necessarily replace it, but find something that you can find satisfaction from now?
So you mentioned that, a lot of us derive our identity from what we do. You've addressed that, but our identity is also derived by who we're with. And you already mentioned, your husband having to go through this and your family. This isn't something where you got sick, came out of the hospital and everything's back to normal. You didn't break a leg and heal it. And you're back to being your normal has changed. So how does that also affect you with your family?
Another great question, and an issue that's not, unique to long COVID, but people with lots of chronic conditions or, trauma or accidents that leave their life changed for a long time. We really had to talk. We really had to reassess our roles. Because when you're in a relationship, whether you realize it or not, each one of you takes on a certain role, and one that you might feel comfortable in, one that you might want to change. But when that change is sort of forced upon you, it can be harder to navigate. So my husband and I luckily got on the same page. We both made really big life decisions to prioritize the things that both of us valued the most. Our main priority was to, of course, keep our relationship intact and simultaneously keep these kids from being totally traumatized and try to maintain a stable household for them. Families look different ways. People's workflows or daily, flow of their household look different. And for us, we had to kind of decide, what does stability look like for us, and work together so that the kids' needs were met and our needs were met. Now that I'm feeling better, I've gone through a lot to process all of the grief that that I've faced. And my husband kind of went into caregiver overdrive mode. And I think his time, now that I'm feeling better and have more function, like, okay, what do I want to do now? And kind of take a breath, and rest is still coming. But I think we've done really, really well, and I'm proud of the way that we've collaborated. It doesn't always work out that way.
Yeah, one of my early episodes was talking with a person that helped people in grief, especially long-term grief, long-term caregiving, and preparing them for situations. So you guys sound like you nailed it and are doing quite well. Now,
I'm happy to say yes.
So now a lot of what you're doing is helping people understand long COVID and deal with it. But I think a lot of people still have an issue with understanding it. So I guess one of the questions I want to ask is, what are some of the myths or misconceptions that, still frustrate you that people have?
Yeah, so a lot of people don't believe that long COVID is a physical condition. They strongly believe that it is a psychiatric illness. That's probably the biggest one. It's a hurdle not only for people in society to believe, because it impacts like your relationships, your work relationships, and accommodations that you can get, but also if your doctor believes that. That limits your access to good health care. So that's a stereotype that I think has been decreasing, luckily, especially as, the Department of Health and Human Services has, acknowledged that this is a condition that's very serious, that there is funding for research, probably not going fast enough, probably not enough research, but the NIH is actively looking at the causes and potential treatments for long COVID. There are guidelines that are coming out. One even recently was kind of approved by the Department of Health and Human Services. So that's the stereotype that I think is the most damaging. And really closely related to that, we have this idea that even if it was a psychiatric disease, it's because of your own moral failing somehow, or that you're just a weak person. Like you're someone sickly. That wouldn't happen to me because I do X, Y, and Z. I live a certain life. But the reality is a lot of people who are now disabled by long COVID were perfectly healthy before their infection. And so these are the really big issues and obstacles that we're facing.
Yeah, it's interesting you brought that up, because I know that there are people that are struggling with, chronic stuff. Chronic fatigue is something I've heard much, much more of in recent years. So I guess the next question after all of that is, for somebody that is listening that may have some of these things and either might suspect they have long COVID or haven't quite yet figured it out, what are some steps that you could recommend that they can take to get themselves figured out?
A great question, and a really important one, and one that I wish was easier to answer. I wish the answer was make an appointment with your doctor, get assessed, get some tests, get diagnosed, and get treated. But right now, we don't have lab work that it confirms or denies long COVID. We are still facing a lack of education among healthcare providers on how to, pick this up. Or notice it, and we don't have enough people who are comfortable treating it. So this is my advice. I would do my best to start with your primary care doctor, And if you didn't really like your primary care doctor, then it's a good time to try to find someone that you feel really comfortable with. And then the second part is to start paying attention to what your body is telling you. This can be really, really confusing condition, and it can have multiple symptoms. So in order to communicate what's going on with you effectively to somebody else, it's first important for you to be able to notice what is going on. You don't have to have the medical terms for it, but you can say, I notice I am getting less refreshing sleep. I'm sleeping the same amount and the same quality, but I wake up completely exhausted. I notice I get winded more easily. I notice after I exert myself, either I, do a little activity, I went through a really stressful situation, I did a lot of hard brain work. The next day, I am completely wiped out. I notice my appetite has changed. I notice, changes with my bowel or my bladder. I notice I feel dizzy when I wake up. I feel lightheaded sometimes. Just notice and, without having to get obsessive over, how the symptoms go every day, just notice and write those down so that you can bring that information to your doctor. If you have had a COVID infection recently, think about when that was so you can report that. If you had a cold or you had the flu or something that you didn't get diagnosed with a particular test, but you got sick, let them know. Those are the first places to start. And I think it's a matter of going from there. If you might have to see multiple doctors. You might have to get workups that come back normal. It doesn't mean that there isn't something wrong. It just means that the tests that you're taking that pick up particular issues are normal. And that's probably good news. So the starting point is taking a breath, taking some time, paying attention to your symptoms, and then finding a good healthcare provider that you can collaborate with.
All right. I'm going to switch gears here and ask you to answer this question, and it's a two-part question. So things are better, you've already said, but what is it right now that is currently able to bring you joy and helps you feel like you again? And then part two of that is, if we were to look ahead a few years, what would give you the most hope?
Love that. I have a lot of joy in my life every day. I'm happy. I get up out of bed most days. I'm slow, but I get up and I engage with my family. I have good friends that I keep in touch with. I have a small but really pretty backyard. I live in a great part of the country, and I get to meet some amazing people who have also been impacted by long COVID. That's like the silver lining, if there is one, about joining this club, like I say, is that there's a lot of other cool people in the club. Nobody wants to be here. Nobody wants membership, but we're here, and it's a pretty remarkable group of people that I've gotten to meet through the podcast and the Substack. And then 5 years down the line, I guess I'll answer what I want. I made a vision board a couple of years ago, and I still look back on it. I'm like, oh, that's still pretty spot on. There's a picture of a woman in a raincoat and a backpack, and she's hiking on it. She's reached the peak of some place. So I'd love to go for actual physical hike and get more and more physical stamina. It has a lot about spending really good quality time with my kids and my husband and my friends. That doesn't always require having to hike up a mountain. And so and continuing to help people and connect with people. So if I can do those three things today, 5 years from now, 10 years from now, yeah, I'm happy.
All right. Well, I like what you're doing now, and I will direct everyone to click the links in the show notes to find out more information about you. And of course, we mentioned longcovidmd.com. That is her website. You can find her podcast there. And basically, it's a website to help you recover like a doctor. So, Dr. Zeest, thank you very much for coming on the show and sharing your story.
Thank you. Thanks for having me.
All right, folks. Well, huge thank you to Dr. Zeest for sharing not just her medical expertise, but her personal experience as both a physician and a long COVID patient. And if this conversation helped you understand a little better or gave you the language to support someone you care about, don't keep it to yourself. Share the episode with a friend, a family member, or even another doctor if they need to hear it. And if you're ever on your own long COVID journey, check out her work at longcovidmd.com to keep learning and to feel a little less alone. So thank you very much, folks. We will be back with more episodes of the Unhealthy Podcast. And until next time, live healthy and be happy.